In this video by deckplate we will understand the VA ratings for wrist conditions. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. When it comes to assessing wrist conditions for veterans, the VA utilizes specific diagnostic codes to determine the severity and impact on daily life. Two common diagnostic codes used are 5214 and 5215, each addressing different aspects of wrist impairment. 5214 wrist ankylosis of. Ankylosis refers to the abnormal stiffening and immobility of a joint due to fusion of the bones. In the context of the wrist, ankylosis can severely limit its movement, affecting essential functions such as grasping, lifting, and manipulating objects. Ankylosis of the wrist can occur in various positions, each with its own implications for functionality. Rating criteria for unfavorable position. Ankylosis in any degree of palmar flexion, or with ulnar or radial deviation, is considered unfavorable. This means the wrist is fixed in a position that significantly hampers its function. For this condition, the major rating is 50%, indicating a substantial impairment that affects daily activities. A minor rating of 40% is assigned for less severe cases within this category. Rating criteria for any other position except favorable. If the wrist is ankylosed in any position other than favorable, it receives a major rating of 40%, with a minor rating of 30%. This includes scenarios where the wrist is fixed in an extended or flexed position, but not as severely as in the unfavorable position. Favorable in 20 degrees to 30 degrees dorsiflexion rating criteria. In cases where there is some degree of dorsiflexion or backward bending present, albeit limited, the major rating is 30%, with a minor rating of 20%. This indicates a less severe impairment compared to the previous categories, as there is some ability to move the wrist. It's important to note that extremely unfavorable ankylosis, where the wrist is rendered essentially useless, will be rated as loss of use of hands under diagnostic code 5125, which may warrant a higher rating. 5215 wrist, limitation of motion of. This diagnostic code addresses limitations in the range of motion of the wrist joint. Restricted motion can significantly impact an individual's ability to perform tasks requiring wrist movement, such as typing, writing, and lifting objects. Now let's understand the rating criteria of dorsiflexion less than 15 degrees. When dorsiflexion or backward bending of the wrist is limited to less than 15 degrees, both major and minor ratings are 10%. This indicates a relatively minor impairment that still allows some movement but may affect certain activities. Palmar flexion limited in line with forearm. If palmar flexion or forward bending is restricted such that it cannot exceed the angle of the forearm, it also receives a major and minor rating of 10%. While this limitation may not be as common as restricted dorsiflexion, it can still impact daily activities requiring flexion of the wrist. The VA utilizes specific diagnostic codes and rating criteria to assess the severity of wrist conditions in veterans. Understanding these ratings can help veterans navigate the claims process and ensure they receive the appropriate compensation for their service-connected disabilities. If you or someone you know is affected by a wrist condition, it's essential to consult with a knowledgeable medical professional and VA representative to understand your options and rights. Thank you for watching this video. Please don't forget to subscribe and like our videos.